Definition. The term failure to thrive (FTT) describes a child who is failing to meet normal standards for growth and development, usually in the first few years of life. The diagnosis requires that the physician look for an explainable cause for the child's growth failure in the child, the family, or the environment. A diagnosis begins by taking serial growth measurements of the infant and child. Height, weight, and head circumference should be measured on each well-child visit, and they must be plotted on a standard growth curve, appropriate for the child's gender, chronological age, and history of birth. Children who are below the 5th percentile, 2 SDs below the mean, or children who are crossing percentile lines, moving from the 90th percentile to the 25th percentile, should be evaluated for FTT. Signs and symptoms. The signs and symptoms will depend on the underlying cause of the FTT and the degree of malnutrition the child has sustained. The child may appear thin with relatively slender extremities and protuberant abdomen. There will be extra skin folds from loss of subcutaneous tissue and wasted buttocks. The child may keep their hands in their mouth as a form of autostimulation. A FTT may stem from 3 etiologic categories: organic, non-organic, and mixed type. Organic FTT. There is some physical or physiologic derangement that is causing the growth failure. Often there are other signs and symptoms such as diarrhea, vomiting, or food refusal. Non-organic FTT. The problems lies with the family or environmental interaction with the child. With this form there will be an absence of any other symptoms. Other signs may include an apathetic child, flat occiput from being left supine, or signs of neglect such as diaper rash. Mixed-type FTT describes children that have a minor medical problem and a family constellation unable to cope with the child's needs. Investigations. The most important test is an accurately plotted serial growth curve. A count of the child's caloric intake is useful. In cases of non-organic FTT, a change in the child's environment may prove a telling diagnostic test. Complete blood count, urinalysis, and chemistry panel. First-line laboratory tests. HIV testing should be considered if there are other parental risk factors. Other laboratory tests should be based on the child's symptom complex. Complications. Uninvestigated FTT may fail to lead to important underlying diagnoses. A non-organic FTT is associated with other family problems such as abuse and neglect that have psychological and developmental manifestations. There is a low but measurable mortality rate associated with FTT. Differential diagnosis. For organic causes of FTT there is a wide differential including chronic urinary tract infection, sinusitis, giardiasis, other parasites, gastroesophageal reflux, food allergy, malabsorption, chronic constipation, lead toxicity, adenoidal hypertrophy, tuberculosis, genetic syndromes, neurologic defects, and HIV infection. Common but incomplete list. In cases of non-organic FTT, there may be problem with the parent, with the baby, with the interaction between the specific parent and child, or more pervasive family dysfunction. Some suspected FTT cases actually represent intrauterine growth retardation or genetic short stature. Consider the size of the parents and their growth pattern. In rare circumstances, there may be inaccurate use of the growth curve or inaccuracies in measurement. Etiology. The cause of FTT is lack of adequate caloric intake, increased loss of calories, or abnormally increased requirements to achieve growth. Epidemiology. As many as 5% to 10% of children may experience some period of growth failure. Of the 3 categories of FTT, 60% are non-organic, 10% to 20% organic, and the remainder mixed. Other information. Some cases of FTT are due to child abuse and must be reported to the local Child Protective Service Agency. Treatment. General information. The first step is try to determine the cause of the FTT. Based on symptoms and signs, carry out studies to determine if there is any organic cause. Or a careful dietary history is helpful in determining cause. If possible, observe a feeding Having the parent complete a caloric diary for a few weekdays and a few weekend days is helpful. When evaluating the child's eating pattern, there are several factors to consider: the proper number of calories, the developmentally appropriate method of eating/feeding, the correct foods, and the proper atmosphere for a healthy mealtime. It is sometimes useful to gain the parent's perceptions of food and eating, as some parental eating disorders may be reflected in the child. Pharmacologic treatment. There are no specific pharmacologic agents that are helpful. However, the physician may need to modify standard dietary instructions in order to maximize caloric intake. Foods that are naturally high in calories, supplements, or special formulas may be necessary.